Hi, and welcome to the Early Retirement Roadmap podcast, the show where I help you prepare for and design a life you love after work. If you're considering retiring before age 65, you've probably asked yourself, what am I going to do about health insurance? Indeed, it's one of the biggest reasons why some choose not to retire early. Today, I'll break down the most common options to bridge the gap before Medicare kicks in. From traditional choices to creative solutions, I'm addressing everything you need to know about staying covered without draining your savings. Whether you're retiring at 55, 60, or even earlier, this video will help you navigate the often confusing world of health insurance for early retirees. So let's get started. Before we dive into the options, let me be clear that what I'm sharing today is based on my personal experience and research. While I'm excited to share these insights with you, this is for educational purposes only. So let's talk about why health insurance is such a critical part of your early retirement plan. Let's face it, healthcare in the US is expensive. There's just no getting around that. Without insurance, a single hospital stay for something like a heart attack or surgery could cost tens of thousands of dollars. For early retirees, that's a financial risk you can't afford to take. It's not just about big emergencies either. Prescriptions and chronic condition management can quickly add up. Without a solid plan, these costs can eat into your retirement savings faster than expected. So let's break down the most common health insurance options and how to choose the right one for your needs. Early retirees have several options to consider. Each one comes with its own pros, cons, and costs. Let's explore these options in depth. The first option is COBRA continuation coverage. COBRA stands for the Consolidated Omnibus Budget Reconciliation Act and allows you to keep the same health insurance you had while employed, typically for up to 18 months and in some cases up to 36. Here's the good news. COBRA provides continuity. You don't have to worry about switching doctors, learning a new plan, or losing access to your current network. This is particularly useful if you've already met your deductible or if you're undergoing treatment for a chronic condition. But here's the catch. It's expensive. Under COBRA, you're responsible for the full cost of the premium, including the portion your employer used to cover, plus typically a 2% administrative fee. For many, this results in sticker shock. Let's look at a simple example. If your employer-sponsored plan costs $1,200 per month, but you only paid $300 while employed, as your employer covered the rest, COBRA will now cost you the full $1,200 plus an additional 2% administrative fee. That's over $14,000 a year. COBRA works best as a short-term solution, especially if you're only a few months away from Medicare or need coverage while exploring other options. For more information, I've provided a link in the show notes to the U.S. Department of Labor's COBRA guide. Option 2, ACA Marketplace. The Affordable Care Act, or ACA Marketplace, is a go-to option for many early retirees, and here's why. ACA plans are guaranteed issue, meaning you can't be denied coverage due to pre-existing conditions. They include 10 essential benefits such as preventative care, chronic disease management, prescription drugs, and hospitalizations. One of the biggest advantages of ACA plans is the availability of subsidies, also known as premium tax credits. These subsidies can significantly reduce your monthly premiums if your income falls within a certain range. The amount of subsidies you received are based upon your modified adjusted gross income, or MAGI, M-A-G-I. The lower this is, the greater your potential subsidy is. As you are considering health insurance options for early retirement, definitely consider it as an option. You can go to the Marketplace website and easily get an estimate of the amount of subsidies you may receive based upon your MAGI and review the various plans available and costs. I provided a link in the show notes for the webpage you can go to browse plans and get estimated prices, and after you enter your zip code, the site will walk you through the rest. You can also enroll in an ACA plan outside of the normal open enrollment period, as losing your employer-sponsored health insurance due to early retirement is considered a qualifying life event. The downside with ACA plans often come with higher deductibles and out-of-pocket costs, so be sure to evaluate your overall healthcare needs before committing. A third option is private health insurance. If ACA plans don't meet your needs, for example, if you want specific providers or networks not covered by the ACA plans, private insurance is another option. However, private insurance tends to be more expensive, especially for older individuals or those with pre-existing conditions. Working with a licensed health insurance broker can help you compare options and find a plan that fits your budget and lifestyle. I've also provided a couple of links in the show notes for a couple of websites you can go to compare private insurance options. Number 4 is short-term health insurance plans. Short-term health insurance can be an option for early retirees. These plans are designed to provide temporary coverage, often as a bridge to Medicare if you're close to the age of 65. But there are some important details and risks you need to know to determine if they're the right choice for you. First, under federal regulations, short-term plans can last up to 12 months, and in many states, they can be renewed for a total coverage period of up to 36 months. This means you may be able to chain multiple plans together to cover several years until you reach the age of 65. However, some states impose stricter rules. For example, in California, New York, New Jersey, and Massachusetts, short-term plans are not allowed, and other states limit their duration or do not permit renewals. Be sure to check the regulations in your state before considering this option. Short-term plans carry fewer risks for people who are healthy and very close to Medicare eligibility, but they still have significant limitations. These plans often exclude pre-existing conditions and typically don't cover the essential health benefits required by the ACA, such as preventative care, mental health services, or prescription drugs. While premiums are lower than ACA plans, they also have lower coverage limits. So if you have a major medical event, it may not all be covered, and you could have significant financial exposure as a result. Please also be aware that insurers are not required to guarantee renewability. So if your health changes during the coverage period, you could face difficulties securing another plan. In summary, short-term plans may be an option if you're looking for basic temporary coverage, especially if you're within a few years of Medicare. But because of their limitations, they may not be the best solution. If you're further away from age 65 or have more comprehensive healthcare needs, it's worth exploring other options like ACA Marketplace Plans or private insurance. The fifth option is part-time work with benefits. Some companies, such as Starbucks, Amazon, and Costco, offer health insurance to part-time employees. This could be a win-win solution, allowing you to stay covered while earning extra income. These jobs typically require 20 to 30 hours a week. While this might not be ideal for everyone, it's a practical option for those who want to ease into retirement or stay active while maintaining benefits. I've provided a web article link in the show notes that has a list of companies that provide health insurance to part-time employees. Beyond the traditional options, there are creative solutions that can help retirees manage healthcare costs as well. Healthcare sharing programs like Medishare or Christian Healthcare Ministries allow members to pool their money to share medical expenses. These programs are often faith-based, though non-religious options like Zion Health are also available. While these plans are typically more affordable, they aren't legally required to cover claims. Additionally, they may exclude certain conditions or treatments. If you're considering this route, be sure you understand what's covered by the program and what isn't, and make sure you're comfortable with the risks. I've included a link in the show notes to 3 health sharing programs in the description if you're interested. Then there's international health insurance. Are you planning to live abroad? Many countries offer high-quality healthcare at a fraction of U.S. costs. Expats often find that international health insurance provides comprehensive coverage for far less. For instance, countries like Mexico, Portugal, and Thailand are popular destinations for retirees seeking affordable medical care. However, keep in mind that you may need to meet residency requirements to access these benefits. I've included a couple of links in the show notes to explore international health insurance and expat-friendly plans. Then there's HSAs. HSAs are a powerful tool for retirees. If you've contributed to an HSA or health savings account during your working years, you can use those funds to cover out-of-pocket medical expenses. If you elected to continue your workplace insurance through COBRA, did you know your HSA funds can be used to pay for your COBRA premiums? This was a provision put in place by the Coronavirus Aid, Relief, and Economic Security Act, or CARES Act, that was signed into law in 2020. The best part, withdrawals for qualified expenses are tax-free. Also, don't forget, if you are enrolled in a qualified high-deductible plan, for example, a plan you got through the ACA, you can make contributions to an HSA that, of course, can help you pay for healthcare costs you have in the future. HSAs are great because they have a triple tax benefit. The contributions you make are tax-deductible, the money grows tax-free through investments, and withdrawals are tax-free when used for qualified medical expenses. And lastly, I want to mention this. Be your own health insurance. What I mean by that is to simply take better care of yourself. It's the best way you can save money on healthcare costs in general and more fully enjoy your life as well. If the stress of your job and business balancing work and home life in your working years kept you from exercising, eating right, gave you insomnia, caused you to gain weight from the not exercising and perhaps also overeating, well, that's one of the great things about retirement. Your stress level drops enormously. And as such, things like insomnia go away, stress eating goes away, and you have more time to exercise and focus on you. The more healthy you are, the less likely you need to go to the doctor and the less healthcare you need in general because you're healthy. With better health, you have more flexibility in your healthcare coverage options. And you're going to save a lot of money because you're not needing to see the doctor much, maybe only for an annual wellness visit, and you don't need to take medications, which also add up. Plus, there are benefits of feeling great, being able to be more active in retirement, and living longer. So let's recap. Your main options for health insurance as an early retiree include COBRA for continuity of care, ACA Marketplace Plans for their affordability with subsidies, private insurance for flexibility, short-term plans for temporary needs, and then also you have the option of part-time work with benefits. Creative solutions like healthcare sharing programs, international coverage, and HSAs can also play a role in your plan if you choose. Choosing the right strategy requires careful thought, but with that, you can bridge the gap to Medicare while protecting your finances, and it doesn't have to be a reason to not retire early. And remember, be your own health insurance by taking better care of yourself. That's all for today's episode of Early Retirement Roadmap. If you found this information helpful, please leave a review and subscribe wherever you get your podcasts. You can also catch the video version of this content on my YouTube channel, also called Early Retirement Roadmap, if you want to see the examples I gave and tips in a visual format. Until next time, this is Mike Upland reminding you to take care and make the most of today.